So, back to the reason for the whole talk. All right, this is what inspired me to pick this topic. All right, these are the guidelines from the NHS. Imaging is indicated when the symptoms persist despite appropriate conservative management. Yeah, fair enough. If there are red flags, yep. Clinical presentation is atypical, yep. And if surgical intervention is being considered, well, yeah, all that sounds perfectly reasonable. But then you move on to this. I would still question it. But it sounds reasonable. But you move on to this, the nice guidelines. Okay. Osteoarthritis can be diagnosed clinically without investigations. Right. If you're over 45, activity-related joint pain, no morning joint-related stiffness, okay, and you do not routinely need to offer imaging. Okay, that's the NHS. And I would put it to you, that is woefully substandard advice. It may suffice for the NHS, where the NHS is desperately trying to save money and where it puts people in patients' way as barriers, right, to try and ration access to healthcare resources. But that is very different from gold standard care. So NICE, I wouldn't call NICE the National Institute for Clinical Excellence. That's not what that's a bullshit title. All right, the honest answer is they are the National Institute for Cost Effectiveness. Or I'd say the NHS Institute for Cost Effectiveness. So it's not gold standard. It's not something to aspire to. Imaging is terribly important. Okay, not every patient needs imaging in every case. But remember, if you're in primary care, if you're frontline, right, then you're going to be seeing a different patient cohort from what I'm seeing in secondary care. So for me, pretty much every patient gets imaging.